My name is Sonal Chandalia. I'm the Chief Nutritionist and Diabetes Educator at Dr. Chandalia's Diabetes Endocrine Nutrition Management and Research Center. Today, folks, we're going to talk about the insulin injection technique, something that needs to be clearly understood and also explained to you well from a healthcare professional or your diabetologist, because this is the key for delivery of insulin in the right amount and in the correct way when you are on any insulin regimen. So this can be required even by type 1 people who have type 1 diabetes, because they need insulin for survival. And many type 2 diabetes also, after many long-standing years, insulin may be introduced along with your medication. And that is fine because it gives you very good glycemic control and it is as natural as possible. The delivery options of insulin can be through the syringe, through the insulin pen or the insulin pump. The injection locations, usually they are all decided and they are prefixed, and you have to follow a particular routine to ensure that it goes smoothly. And the timing, the synchronization of your insulin administration with your meals as well as with your activity is what will be prescribed by a physician or your healthcare professional, and you need to understand that. Now, when we come to insulin syringes and needles, we know that we may be using disposable needles and syringes with the insulin injections. You have to check the markings are correct, the dosage that you're taking. How do you check that? Now, usually we get the U40 and the U100, and one will be orange and one is red. You buy the color code also, one can remember it and it can be given accordingly. But you must remember that when you're taking U40 dosage, then you need to take an insulin which will be U40. And when it's U100, you take the insulin which is U100. If there is any conversion that you're using a U40 insulin in a U100 syringe, there is a conversion factor that needs to be learned from your healthcare professional, and then you have to administer it. Otherwise, you'll have the wrong dosage going in and vice versa. The only exception to this is glargine U300, which is, even though it says U300, you have to take it as per the dosage prescribed. There is no change in this, in the insulin amount that you are taking. The insulin pens will be calibrated for about 100 units per ml. So accordingly, the dosage as it is put and it is prescribed, you will be dialing the pen and taking it accordingly. Now there is, as you can see in this flow chart, there is a mixing technique for the insulin vials where you go stepwise and follow it. It is important to note in this that there should be, in the essential points are that you must note is that there should be no air bubbles as you're doing it when you draw the air. And if there are, then you have to discard it. You have to put the insulin back and again and draw it out. And you make sure that you do it accurately and you do it in the manner that you can really see the calibration correctly in an insulin syringe and when you're mixing the insulin. If it's a single insulin, it's easier, but when you're mixing it, it has to be in this particular method between cloudy and clear. The next thing that we need to understand also is the insulin injection technique, the injection sites. Now, the injection sites, if you see, usually you will find that they will be in areas where the stomach, they may be at the arm, they may be at the thigh. The very important thing to note is that if you rotate the sites, there can be several sites. And you have to rotate the sites for every insulin injection shot that you take. And usually the best absorption that we've seen is at the abdomen, then at the arm, and then at the thigh. So when an insulin injection technique is taught to you, the best is to always take a demo when you visit the diabetologist or the healthcare professional for the first time. Administer it a small dose yourself, be taught, and then you can do it correctly henceforth. Now, the main thing to remember here, as you can see in this chart, is that you administer it correctly. It is subcutaneous. You have to lift the fold a bit and it should be at 90 degrees and not at any other angle for complete delivery. And also you should discard the needle, correctly because it is a bio waste. So these are some of the points that have to be kept in consideration. After this, you can see here that there is a simple picture of an insulin pen where it will usually have a cartridge with certain ml that will be used over a period of time. And how you store this is important, but the insulin pen is very convenient because you can just dial the dose. You can either have which are pre-filled and they are already a mixture, or they are individual and then you have to use two different pens. So the points to keep in mind while you're using the insulin pen is that you need to know the insulin injection technique correctly, do the site rotation correctly. If you're using an alcohol swab, let it dry before you inject the insulin. And if there is no alcohol swab, you have to ensure that that particular injection area is clean. The injected insulin can be kept at room temperature. You do not recap the pen with the needle because you're likely to prick yourself. So you remove the needle and then you cap the pen. You do the site rotation as it is taught on a regular basis. And you use the pen needles effectively only maximum for about 2 to 3 shots, because if you use it any longer and it's blunted, it will not give the delivery of insulin correctly. Ideal is to use it once. And once you have done the insulin injection technique correctly, whether you're using an injection or you're using a pen, the same rules follow for both. Now, there can be one side effect, as we call it, of that's called lipohypertrophy, where sometimes you find a thickened rubbery lesion or mass of skin in the subcutaneous tissue that you might see because you're administering insulin at that particular point. So you have to just be careful of that, and site rotation helps prevent this. So when there is sometimes a long-term insulin use, or if you're not rotating the injection sites, then reusing needles, you're likely to develop hypertrophy. So remember that if you do it right, there will be no difficulty with administrating insulin, and you'll be very comfortable. Another fact that I'd like to bring to your notice is that in pregnancy, you can still administer the insulin in the abdomen. And also, most people are scared that the needle pricks and it hurts. But remember that even when we had given insulin to a child who is asleep, the child only turns in the sleep and it's almost virtually painless. So please do the right insulin injection technique, do the site rotation, and everything goes well.